How can you strength train if you're over 50 and you're dealing with knee pain? And what are the smartest ways to do it without making things worse? Today, I'm sharing 4 simple principles that will help older adults build strength while protecting their knees so you can feel confident and capable and pain aware in your workouts. Part of my fitness journey includes 2 total knee replacements. And as a fitness educator working with adults over 50, I've seen firsthand how right strength training actually reduces knee pain. So let's start first with a mind shift, and then we'll talk about our strategy. A lot of people believe that knee pain means they should avoid strength training. But here's the truth. Motion is lotion. That little saying is true. And strength is protection. When you stop moving because you're afraid to hurt your knees, the muscles around the joints weaken and tighten. And those muscles actually start to hurt more. The knee becomes more painful and more unstable, leading to further degradation. Strength training done the right way, the right pace, the right approach, builds a stronger support system around the knee and improves joint alignment, reduces inflammation, which really is what's hurting, and helps you do everyday activities with much less pain. So, knee pain isn't the reason for quitting strength training. It's the reason to do it smarter. Let me walk you through how. Principle number 1, strengthen around the knee and reinforce that first. When your knee hurts, you don't want to start out by loading the knee joint directly. Ow. Instead, think about strengthening the support system first. I'm talking about your glutes, your hamstrings, your quads, your hips, your core, your calves. All of the muscles around the knee joint need to get all hands on deck. After all, these are the muscle groups that keep your knee tracking well during the movement. And when these muscles are stronger, your knee stays more stable, more supported, much less irritated. And as those muscles continue to get stronger, your knee kind of lets go of some of the irritation in the form of inflammation and starts to move better. You know, I'm not quoting someone else's words here. I am quoting myself. I went through this myself twice. I didn't rush back to deep squats. I rebuilt my foundation first. A strong foundation reduces pain. A weak foundation increases pain. Principle number 2, use the 3 out of 10 pain rule. Because anything that's recovering from injury or surgery is going to hurt a little as it's getting well. Here's the simplest way to know whether you're training safely for that knee joint. A little discomfort, go slow, you're okay. But if it's sharp or stabbing or escalating, stop. On a scale of 1 to 10, your exercises should stay in the low mild range, around 3 out of 10. Not 0, but definitely not intense. This gives you permission to move confidently instead of hesitating or fearing every little sensation that you get. Your body will usually tell you the difference between this is new and this is wrong. Principle number 3, modify your range of motion. This is so important. You don't need to do the full depth of a squat that you were doing before, or full depth of lunges or any other big ranges of motion when your knees are irritated. Start smaller range of motion, half squats, mini squats, shallow wall sits. These all count. You build strength in the range of your body that it will currently tolerate. And anybody who's gone through physical therapy knows this already, that over time, that pain-free range expands a little bit. You can do a little more, just slowly day after day. So instead of forcing depth, focus on control, breath, stability, and quality of movement. I like to go inside and I actually have a conversation with my knees. People think it's a little psycho, but here's a little trick. When I get done with an exercise and I know that my knees are getting better and it was a little uncomfortable, but I'm better, I actually pat my knee and say, good job. Like it's a 5-year-old child who just did a chore correctly. But you know what? The body's listening because here I am today. Think of it like building a bridge. You lay down the strong supports first, and the span gets longer over time. And this is the stage where patience is so important. Some days it's a little easy to get down on yourself. You're a little more twingy some days. Maybe it's just whatever. Sometimes the humidity, you can feel it a little more. But it's hard to go slow when you want to move past this stage in the worst way. Just get over it. I found myself needing to practice compassionate language in my self-talk. And it really helped me kind of look at my knees as people and treat them with kindness and understand that they're doing the best they can with the situation they're in. Principle number 4, choose knee-friendly strength exercises. Now, that's kind of hard to ask of you if you don't have an expert with you and you're not sure what you're doing. Some of you listening, I know you've been lifting a long time, so you know kind of the right form and what weights, and then you know how to notch it back to make it lighter or to change the angle. But some of you listening are just kind of like winging it and doing the best you can with what you know and what you see, what you've heard, and you're making progress. But it's very important in something this tender that if you are not already knowledgeable about strength training, and maybe you're not in favor of budgeting the money to pay for a really good trainer, that you work with a physical therapist for 2 or 3 weeks to get an assessment to make sure that you're not hurting your knee by doing these things, and to give you a routine that can slowly expand in its challenge safely so that you have the right exercises that are the most strategic to target your issue. And you can get a routine worked out where you can absolutely have it designed just for you. It will give you the powerful start down the road of recovery, and you'll have a go-to expert where you can come back occasionally when you need an upgrade in your routine. Having said that, let me give you a list of the exercises I use the most often when clients have knee pain. The ones I used myself when I was recovering. Whenever a new client would sign up and say, now I'm a little worried because I had an ACL tear. It's repaired, but I'm worried, I'm like, okay, you came to the right place, honey, because I understand and I know what the twinge is and I know what the bad pain is. And I am very familiar and respectful of that situation. So here are safe, accessible, and incredibly effective moves that you can try. One is the sit to stand using a chair. You can start with a higher chair that's where your thighs are slightly not parallel so that you're a little higher than parallel, and slowly move till you're parallel. So the sit to stand, of course, is a functional exercise that you need to do every day anyway. So it's a great place to start, but less flexion in the beginning. Then another one is the glute bridge, where you lie on your back and then you hike your hips off of the ground and you have to hold and squeeze. That's very good for all of those upper leg muscles that need to support that knee. And it's static so that you're not moving at all in that. You're just squeezing and getting that blood into the right muscles. Another one is hip hinges or light deadlifts. So the RDLs, but don't start on the ground, come up and just don't go down as far as you lean forward until your legs are stronger. Another one is step ups. The classic ones are kind of high. So start with a step that's kind of more like a stair step. So it's scaled back to a real life step. and get that going, and make sure that your knee is nice and straight, your foot is in alignment with your knee, and just push with those leg muscles. Another one is the clamshell, where you're lying on the side and you're opening your legs and squeezing and strengthening the medial glutes and the abductors. Those are the ones on the outside. And then standing hamstring curls are really good. So you can attach a band to your heel and then anchor it to the ground, or anchor it with your foot and just kick your foot back and lift that band. Another one is a mini squat, where I call it like a 3/4 squat, where you don't come all the way down to parallel, just come part way down. And you can practice that as a wall sit, which is great. So do the wall sit first, kind of slide down the wall until you're kind of at 3/4, maybe a little lower as it's more comfortable, and hold it. And then step away and do some mini squats and see how it goes. Those are some ways to kind of nudge into and come into a routine in a very gentle manner. Now, what these moves all have in common is that they are things that strengthen the muscles, that stabilize your knee without overloading your joint. That's what you want to go for. And here's the most important thing. Slow, controlled movement builds strength. Rushed, sloppy movement builds pain. Take your time, move deliberately, especially on the lowering phase. That's where the magic happens. And I want to remind you of something that I learned through my own knee surgeries. You don't need perfect knees to get strong. Your knees don't have to feel amazing today for you to work on strengthening them. You just need the right approach and to be very intuitive into what's going on and what you're feeling. I rebuilt my strength using these exact principles, safely, slowly, consistently. And some days it really tried my patience. So if you have those kind of days, don't beat yourself up. Just stay in there and keep being patient and kind to your knees. And if you can do it if I can do it in my 60s, then absolutely you can too. Your age isn't a barrier. Your knees aren't a barrier. You're capable of so much more than you think. If this was helpful for you, because it's a very specific area that I focused on, you'll love my other videos on strength in general and healthy aging and nutrition. So hit subscribe if you don't want to miss the next one. And tell me in the comments if you have an area that you would like more information on that I haven't covered and you're just curious about what I think about it, or just need a little boost, a little encouragement, a little more information on. So until next time, keep aging strong.